Did you know how serious diabetic foot infections can be? Let's take a moment to unravel this medical mystery. Diabetic foot infections are a serious health concern, particularly for those living with diabetes. These infections are a result of a complex interplay between neuropathy, peripheral vascular disease, and hyperglycemia. These factors contribute to the development of foot ulcers that are not only difficult to heal, but are also prone to infection. Let's delve deeper into the clinical features of this condition. Identifying an infected ulcer is crucial in managing diabetic foot infections. Not all ulcers are infected, and it's important to remember that. Diagnosis of an infected ulcer is based on the presence of at least two of the cardinal signs of inflammation: redness, warmth, swelling, pain, or the presence of pus. In some cases, crepitus, osteomyelitis, and systemic toxicity may also be present. Visible bone or the ability to probe to the bone is a clear sign of osteomyelitis. The severity of the infection can range from mild to severe. Mild infections are superficial with no bone or joint involvement. Moderate infections are deep, extending beneath the superficial fascia and involving the bone or joint. Severe infections, on the other hand, present in a patient with systemic toxicity, which may include fevers, chills, tachycardia, and hypotension. Now that we know the signs, let's discuss how we can investigate these infections. Investigations play a key role in diagnosing and treating diabetic foot infections. To identify the organisms responsible for the deeper infection, a curettage specimen from the ulcer base, aspirate from an abscess, or a bone biopsy is required. Superficial swabs don't quite cut it. If the patient has a fever, a blood culture and sensitivity test, or CNS, is necessary. Now let's talk about osteomyelitis. Early stages are hard to catch on an X-ray. If the initial X-ray is normal, a repeat X-ray 2 to 4 weeks after starting treatment increases test sensitivity. An MRI or bone biopsy becomes essential if the initial X-ray is equivocal. Treatment for diabetic foot infections includes evaluating for early surgical debridement, revascularization, or amputation. Antibiotics like cephalexin or clindamycin for mild cases, and clindamycin combined with ciprofloxacin or pip/tazo for moderate to severe cases, are usually administered. And let's not forget the importance of glycemic control. Remember, early detection and management can prevent severe complications. Diabetic foot infections are serious, but with proper knowledge and care, they can be managed effectively. We've discussed the causes, clinical features, investigations, and treatments. Remember, early detection and prompt appropriate treatment are key in managing these infections. Glycemic control and regular wound care are also vital. If you found this video helpful, please subscribe and share it with others. Your support helps us provide more quality content like this. Don't forget to leave your thoughts in the comments below. Preventing amputation due to diabetic foot infections is crucial. These infections can lead to severe complications such as gangrene and non-healing foot ulcers. If not managed appropriately, these complications can necessitate an amputation of your toe, foot, or even part of your leg. Surgeons often resort to this extreme measure to prevent the bad infection from spreading to the rest of your body, and ultimately to save your life. However, this dire consequence can be avoided. With proper care and treatment, amputation due to diabetic foot infections can be prevented. In the next segment, let's delve into the measures one can take to prevent amputation due to these infections. Here at Medicine Health 360, our mission is not only to educate but also to empower. Our extensive library of videos covers a broad range of topics, from simple preventive measures to complex medical procedures. We aim to provide you with the latest and most systematic medical and health knowledge, all presented in a way that's easy to understand. We believe that everyone deserves access to quality health information. By learning more about your health, you can take proactive steps to improve your life. So, don't stop at this video. Dive deeper into our channel, explore more topics, and arm yourself with the knowledge you need to live a healthier, better life. Remember, prevention is better than cure, and knowledge is the best form of prevention. Stay tuned for more videos from Medicine Health 360, your trusted source for health education.